Good afternoon, Dr. Lenny Roberts from Summit Spine and Wellness, and I'm here with a friend of mine, Dr. Jesse Fields. Dr. Jesse, thanks for joining us.
Thanks for having me.
So Dr. Jesse and I have a mutual friend that introduced us a little while back as she opened up a beautiful new facility not far off from our office in Lafayette Hill called Climb. Could you give us the exact location? I don't know the name of the cross street there, but
Yes. We're at 633 Germantown Pike. It's basically at the corner of Germantown Pike and Crescent Avenue, between the market, which most people know in Lafayette Hill, and the Persian Grill. We're like the new big two-story building.
yes, beautiful, beautiful facility. I had the chance to get in there for a yoga studio Wim Hof breathing event a while back, and then had the pleasure of coming up and seeing your space recently. So that's kind of what prompted us to get together here. So Dr. Jesse, do you mind telling us a little bit about yourself and what got you to be opening the doors of Climb?
Yeah. So I am a board certified internist. So I did college and med school and then a residency in internal medicine at Tufts in Boston. And then I joined a kind of traditional primary care practice at one of the big enterprise practices in the area. And I thought that was going to be my career. I was there for 10 years and initially it was kind of good. I was learning kind of all sorts of outpatient and as well as inpatient medicine and really taking care of a broad array of people. And then a few years in, I realized, yeah, we're seeing a lot, but I'm not feeling like I'm actually connecting with people. I'm not giving people adequate time. It's like very fast pace. And you could certainly tell from the patient's perspective too, that like there was more to talk about, but it was kind of, they just had to kind of go through the door and couldn't get everything out. And it kind of started then a few years into that practice that I was like, this isn't really how I want to have my whole career. I want to build relationships. I want to talk about people, about how they live, talk about prevention, talk about, right, how people are moving and eating and actually life on a daily basis, and not just kind of put Band-Aids on problems. So several steps to kind of get where I am, but I took the leap and left the traditional primary care model. And September of 22 opened Climb Health and Wellness, where I am a concierge primary care provider, which means more access, longer visits. I have a relationship with my patients and they can get a hold of me whenever they need me.
Nice.
And then we also have support with mental health, fitness, and nutrition to really try to support the whole person.
Awesome.
Not kind of silo care, but really complete care.
Awesome. Very cool. So a little bit more on the concierge.
Yeah.
I definitely know what it is, but I want to make sure that the people listening understand that approach. Obviously, your accessibility and availability is a huge benefit. Can you tell us a little bit more about like that model and how that works?
Sure. So in a traditional model, it's all insurance based and you go to your visit and you pay whatever your copay is. And you have the visit and then the office bills insurance for that visit. Depending on what type of visit is, I'm sure people have in the past gotten bills for like a second visit because they took care of a preventative issue, which is typically covered, but then they had a few problems and that office billed for the problems as well, which in the coding insurance world is separate visits. And everything is kind of tied to these like, well, how much should we talk about? How much am I billing you for? And that's the insurance model. So concierge care, which is also called direct primary care, kind of eliminates all of those minutia from the visit and you just have visits. So there's a monthly fee. Some concierge practices do an annual fee. We do a monthly fee because we want this to work for everyone, for all of our members. So there's no like long-term commitment up front. And so it's monthly fee, but hopefully, obviously, there will be a long-term commitment. And if something's not working, we talk about it and figure it out. But generally, kind of, you just get billed one day a month on the same day every month, and you
Mhm.
get care. So you get your first visit, which is typically like the established visit, preventative visit, talk about all of your history, talk about health goals, talk about chronic conditions if you have any, talk about, right, your dietary habits, your sleep habits, your movement, exercise habits, and then kind of set a plan for kind of where you want to be, where you want to see yourself, if there's anything specific you want to work on.
Awesome.
And then from there, all of the visits kind of depend on what your needs are. So if you're someone who has a medical condition like hypertension or diabetes or something, we're going to check in more frequently, at least every for 3 months, if not more frequently. But if there's no specific condition to follow up on, it's kind of at least once a year, if not twice a year, to kind of check in, either telemed or in person. But then whenever you have a question, if there's a sick visit, if anything comes up, you can have a visit in person. You can call and I answer the phone when you call. So there's no like trying to get a hold of the doctor or the nurse, and maybe you'll get a call back later that day, maybe, unlikely. Maybe you'll get a call back in 3 days.
Mhm.
Like, you just get me when you call. Same thing with portal messages. You message, I typically respond almost immediately, as long as I'm not with a patient.
Sure.
So it's just that access and that relationship. And then an added bonus too is, so I'm a certified personal trainer. So in between the medical care, and whatever, again, that looks like for you personally, I'm around, I teach a boot camp class every day, Monday through Friday. I
Nice.
often attend some of the other like yoga classes and workshops. So I'm just kind of around and in it, so that you get me as a person, not just as this doctor in this office. And it builds from there, and we see each other in life,
Mhm.
um, so that if something's off, you feel comfortable reaching out to me to talk about it, or even I recognize it in you and we figure it out together, and we then have a formal visit, or we do whatever we need to kind of get things back on track.
Very cool. And do you have like a age, gender, like do you work with all
Um,
sizes, shapes, and backgrounds, or do you have
Very
like a
good question. Most of our patients are probably about 40 to 75. Although we have some patients in their 30s, and we have one in his 20s, and we have one 90-year-old.
nice?
So we're kind of all over the place with that. But the bulk of our patients are probably 40 to 75, where you don't have like little kids running around, so you can really invest in your health, without other things kind of pulling at you from time constraints standpoint. And we're pretty split, men, women. It's like slightly more women, but it's not far off from 50-50.
Cool. Very cool.
And
And
well,
with your background, obviously internal medicine, you do, is there like specific conditions that people would be a good fit for? Obviously, you offer a lot, but is there like specific conditions? You mentioned high blood pressure. Is there things that you would say are like your specialty within your specialty, I guess?
so not really. So internal medicine, we do the whole body. We do everything.
Mhm.
So it's frontline for everything. And then depending on how specialized your need is, oftentimes I can kind of continue the care. And then sometimes you need a specialist,
Mhm.
like a cardiologist or an endocrinologist. And I can facilitate those appointments. I talk to the specialists all of the time. Again, whether that's like medical specialty, like I just mentioned, like a cardiologist, a pulmonologist, an endocrinologist, or whether that's an acupuncturist or a chiropractor. And I really try to facilitate those visits, especially for the medical specialties, when I know it can be really difficult to get an appointment. I'll reach out to doctors for you, to get appointments in a reasonable time frame.
Mhm.
Um, and then I connect with that doc often before you see him or her, and after. So
Awesome.
it closes the loop, care is really coordinated, questions get answered, and everyone is on the same page. But again, back to the initial question for me. So I cover basically everything. I mean, all of the most common kind of chronic conditions, like I said, high blood pressure, diabetes, are like the most common things.
Mhm.
But then any kind of acute stuff, so whether it's colds and flu or cellulitis, which is an infection of the skin, kind of GI stuff, I I can see you for all of that and hopefully treat and support. But again, if not, I can facilitate the specialist referral.
Awesome. Well, definitely a wonderful resource. That's why I wanted to get you on one of these recordings here so we could share it and let more of our patients know that you're there and what you're doing. So anything else that you'd like to share before I know you're a busy young lady, so don't want to take up too much of your time, but anything else you'd like to share that we didn't cover?
No, I mean, I really appreciate the time. Thank you so much. I know you do amazing things over there at Summit and your community. So it's really great to be able to share what we do here. And really, medicine and healthcare should be here for you. And I think over my almost year and a half here at Climb, it really is like in front of me every day and how dramatically different we do care. I do primary care, and we as a collective with the mental health, other fitness providers and dietitians, how we do things differently here and really get people to invest in themselves, feel supported, and just take a different, hopefully better approach to yourself and your health. So
Awesome.
I'd love to continue to chat with anyone who's interested. It's Climb Health and Wellness, and our website is myhealthclimb.com.
Awesome. myhealthclimb.com. Very cool.
Got it.
Well, I appreciate your time and appreciate what you're doing, and it's a pleasure to work
you.
together in our community to try and make it a better place. So,
You got it. That's the goal.
good stuff. Thank you very much for your time, Doc. Have a wonderful
Thank
rest of
you
your
so
day.
much. Take care.